At this point here, she is going to put on her sterile gown. She approaches the field, grasps onto the gown, allowing the gloves to drop back down onto her sterile field, steps back, allows the gown to unfold, and she wants the inside of the gown facing her and the armholes facing her. At that point, she'll allow the gown to unfold onto her arms, and with one breaststroke motion, she will pull the gown over her arms, never allowing her hands to come through the cuffed end of the gown. At this point, an unsterile person in the operating room would come and tie the back of the gown, keeping your hands on the inside of the gown. Come to the neck first and snap, and then go down to the waist using the inside snap or tie on the waist, and never touching the outer snap. That's for the back draping process. Now she's going to cuff over her sleeves and open her sterile glove pack. First of all, make sure that the pack is facing you. Place it down in the middle of your sterile field. With her cuffed hands, she's going to reach inside the packet to expose the gloves. She will be lifting up either the right or left glove to place it onto her hand. Open the cuff. Don't allow your hands to come through the end of the cuff, though, and place the glove down, fingers facing your elbow. Line up the cuffs on the end, and with your opposite hand, grasp the cuff and pull it up and over the cuff of the gown. Grasp onto the gown and the glove and pull, and allow your hand to slide into the glove, making sure that the entire cuff is covered. The entire knitted cuff is covered. Pick up the opposite, and once again, open your hand, get it ready to accept the glove, grasp it, lift it up and over the open end of the gown, and allow your hand to slide gently into the glove. Now at this point, you are sterile. You need to stand with your hands at your waist level at all times. If your hand drops down beneath your waist, you are considered contaminated, and you must change your gown, or you must change your gown and gloves depending upon the contamination that occurs. Now we're going to follow through with gowning and gloving the surgeon. The surgical technician will be standing at her sterile field. On her sterile field, she will have gown and gloves ready and prepared for the surgeon. The surgeon will enter the room after his 5-minute scrub, and at that point you will have the towel ready to place over his arm, never touching him, remembering that he is unsterile and you are sterile. At that point, while the surgeon is drying his hands, it gives you an opportunity to go to your table, pick up your gown, and get your gown prepared to place it onto the surgeon. Now, the armholes are going to be facing the surgeon at this point. This is going to be directly opposite that you put the gown on yourself. You want a nice big cuff over your hands so that you are protected from the unsterile surgeon. Place the gown onto the surgeon's shoulders. Do not go over the shoulders with the gown. You must expose the surgeon's hands at this point because you are going to be placing the gloves on the hand. We always place the right glove on first, uncuff the glove, thumb facing the surgeon, give a nice big stretch so that the surgeon can express his hand down into the glove and pull the cuff up and over the entire gown cuff. Again, surgeon may grasp onto the second glove and place the cuff up and over the gown cuff. Now at this point, the circulating nurse or the unsterile person would tie up the back of the surgeon's gown. Once the second glove is placed onto the surgeon's hands, be ready to unsnap the back drape of his gown, and he is going to turn and be back draped, and then he will indeed turn you and back drape you. Just give a slight turn and snap, and now your back is covered and you have an area so that you are covered surgically, well, sterile in the back. It's not really sterile. Your back is never sterile, but it is an area of protection onto your back. At this point, the technician has contaminated her glove, and we're going to show you how to re-glove during a case when your gloves have become contaminated. First of all, the circulating nurse will be removing the contaminated gloves from you. You express your hand, and she's going to place her hand and pull the glove off of you. Second glove, again, is pulled off of you. Now, at this point, you cannot put your hands back into the sleeves. Your hands must be opened and expressed to accept the new sterile gloves. This is called open gloving. The unsterile person will open the glove pack for you, place it down on an unsterile field, and open the entire glove pack from the outside of the pack so that you can reach in and grasp onto the glove. Now, what you're going to do is you're going to, first of all, reach in, pick the glove up and away from the field using your thumb and your finger on the outer cuff. Cone your hand and slide your hand into the glove using small rotating motion. Bring the cuff up and stop. Drop the cuff. Now, with your sterile glove, place your fingers underneath the cuff of the glove. Lift it up and away from the pack. Slide your fingers in and spread them slightly so the cuff doesn't unroll when you go to place it onto your other hand. Again, work the hand into the glove, and with a rotating 1, 2, 3 motion, lift the cuff up and over the glove, the gown, so that the entire cuff of the gown again is covered. Go underneath the cuff of the opposite, and again, up and over the cuff. And this is how you will replace contaminated gloves during a case only. If contamination of a gown occurs during a case or at the completion of a case, there is a proper way to remove your gown and gloves so that you don't cause any contamination on your scrubs or onto your skin. You want to properly protect yourself. So what I'm going to do is the unsterile person will come and unsnap or untie the back of your gown. I've placed the edge of the gown over her shoulder. She's going to move the gown away from her, keeping all of the contaminants on the inside of the gown, roll it down over her sleeves, and drop it into the proper receptacle. And then she's going to remove her gloves, glove to glove and skin to skin. So never touching the contaminated part of your gloves. And then dropping that also in the proper receptacle. There are many instances that you may have to put on a pair of gloves without having a sterile gown on. Some outpatients where doctors like to have you cut a suture, or tonsils where it's considered a clean case, you may have to put on a sterile gloves, and this is how we're going to do it. We're going to open glove without a gown. First, she's going to open her glove pack, remove her gloves from the pack, and open the glove pack from the outer, not contaminating the inside of the pack. Reach in and grasp onto the cuff of the glove, again up and away from the sterile field. Cone her hand and work her hand into the glove without removing the cuff as much as possible. Reach underneath with your sterile fingers, lift it up and away, give a little pressure to maintain that cuff, and slide the hand into the glove. Once again, 1, 2, 3, lift the cuff up and onto your arm and drop it. Remember, you do not have a sterile covering of your arm, so do not touch the arm with your sterile gloved hand.